Hi friends, my name is Dr. Hariram. I am an interventional cardiologist from SLG Hospital. This World Heart Day, I want to brief you all about various risk factors that are responsible for causing heart diseases. So our country is probably in the next decade going to be a capital for heart diseases. Why? Because we have so many risk factors and we are not taking proper care of that. So I want to tell you what are the important risk factors and how we can take care of them. So the most important risk factors are hypertension, diabetes and cholesterol. So what is hypertension? For a broad general public layman, any blood pressure more than 140/90 persistent for some few days, multiple recordings is hypertension. So when you get yourself checked, if blood pressure is more than 140/90, please contact your nearest doctor and start treatment. In the same way, diabetes. So what are the cutoff values for diabetes? A fasting blood sugar of more than 126 and a post-breakfast blood sugar of more than 200 or HbA1c more than 6.5, you are in a zone of diabetes and you require treatment. And what is cholesterol? So cholesterol is basically what we eat and also what is produced in the body. Ideally, cholesterol is very important for making a lot of substances that are useful for the body, but in excess it is going to get deposited in the blood vessels of the heart, and gradually over a period of time they are going to block your blood vessels. So cut down fatty foods, junk foods, cheese-based foods, burgers, pizzas. All those things are very high in bad fats and are responsible for bringing early heart diseases, especially in the young population. So these three things are very important, and most important is not just knowing about the risk factors, but whether they are present in you or not. So know your numbers, know your blood pressure, know your diabetes, know whether you have diabetes, what is the blood sugar, know the cholesterol, LDL cholesterol, HDL cholesterol and triglyceride levels. So what are the other risk factors? Other risk factors are smoking. So smoking, in fact, we have found out that in our country, smoking is the most important thing for responsible for heart attacks in very young population. So we see a lot of patients 20-25 years coming to the hospital with heart attacks. They don't have any diabetes or hypertension, but the most important thing is smoking. So this smoke, the important substances which are present in the smoke, they are responsible for damaging the blood vessels and result in heart attacks in very young. Other important thing is excess body weight, which we call as obesity. Why is it there now? Because we are all accustomed to sitting in the desks and then sitting in chairs and no exercise at all. So reduce weight by doing regular activity. What is the regular activity? At least 30 minutes of exercise per day. It can be anything: walking, jogging, running, swimming, anything. A minimum of 30 minutes of exercise per day, and at least 5 out of 7 days. It's not like you do today exercise and then do exercise after 5 days. So do a regular exercise. And other important risk factor is obstructive sleep apnea. What is obstructive sleep apnea? You see a lot of people in your own family, a lot of people who are obese, they snore a lot. So this snoring, you take it as a very light thing, but this snoring is very important issue, and it results in a number of problems, especially for the lungs and the heart. So this is responsible for a lot of arrhythmias, what we call fast heart beating and then resulting in sudden deaths. They also are responsible for damage to the lungs. So if somebody in your family is having a habit of snoring in the night, take him to a doctor and get studies which are very easy to be done. They are called a sleep study, and it tells us whether this person is having a real issue and requires treatment. Other important risk factor is whether you have anybody in your family having a heart disease at a very young age. Suppose you have a relative, you have your own brother, father, mother, sister who have heart diseases at the age of 40-50 years. So you are also at risk of getting this heart disease, heart attack. So when you have anybody in the family having a heart attack at a very young age, please get yourself checked. Get regular checkups. Get a ECG, 2D echo and a treadmill test. That will give us an idea of what is the status of your heart and whether you have any acute or chronic heart problem and requires any investigation. Thank you.